Hello everyone, and welcome to this first audio podcast. First audio podcast as part of this series, the Ghromulin series. This audio podcast as part of the Photon Saga, and this audio podcast as part of as part of a Storm Robotics production. So in the synopsis, there was a little bit in regard to the overall sort of aspects of this Gromulin series, of this Photon Saga. In this audio podcast, a little bit of intro as part of this a little bit of introduction or intro as part of this works. And before going on, also listeners and viewers, to iterate that this work is works that again is from 2008. Some retrospective works that was sort of developed in a part of academia in 2008. In part of academia, in a part of academia in around 2008, and where there was a collaboration between pharmacology, a pharmacology specialty, and also a sort of and also where colleagues and collaborators at the time had had expertise, for example, in around the specialty in around the cardiology specialism, and uh, uh, to additionally iterate here that most of the audio podcasts, most of the audio podcasts in as part of Storm Robotics Productions have looked at sort of have looked in around aspects around nephrology and kidney care in around and in around pathology and laboratory medicine. However, in this particular series, sort of a look at sort of aspects of pharmacology, sort of pharmacology research, or pharmacology research, and again linked to an aspects of cardiology, and works from 2008. So coronary like conditions, coronary like conditions, or cardiology like conditions, or cardiovascular like conditions are leading causes of death worldwide or globally. Retrospectively, 3.8 million and 3.4 million, 3.8 million males and 3.4 million females die of the disease, die of coronary or cardiovascular or cardiology like conditions each year. Retrospectively, at the same time, at the same time, cardiovascular condition, the cardiovascular condition, coronary heart disease, or CHD, has been responsible for in around just under 17%, around 16.88% of total deaths in the United Kingdom, in at least in around 2006, which translated to more than 94,000 deaths. Although CHD mortality rates have been decreasing since the late 1970s, due to advances in management of risk factors, CHD or cardiovascular conditions still pose burden on uh, on uh, on and in amongst healthcare, healthcare resources and systems. So mortality at the same time, can be reduced by interventions that allow the rapid return of blood flow to the ischemic zone, of the myocardium. To also, before going on, before going further on, listeners and viewers, to inform that the I that that much that much of the works in this in as part of this series we'll look at the term, or we'll look at sort of in around the terminology ischaemia, ischaemic, and ischaemic and ischaemia and reperfusion. Ischaemia being that part of particular vessels, for example, that there is a restriction around blood flow, for example, as a basis or underpinning sort of definition. So mortality can be reduced by the use of interventions that allow rapid return of blood flow to ischemic zones or ischemic zones of the myocardium. And for example, through a reperfusion therapy, early and successful myocardial reperfusion with the use of thrombolytic pharmacotherapy, or primary percutaneous thrombolytic percutaneous coronary interventional PCI has been an effective strategy for reducing the size of a myocardial infarct, for example, and improving clinical outcomes. Moreover, reperfusion, intriguingly, and this is one of the more intriguing sort of phenomenons in around the theme of this works, in around the theme of this works, and in amongst the literature in regard to ischemic reperfusion therapy, so ischemic reperfusion injury, and that is to say that reperfusion can paradoxically exacerbate myocardial tissue injury also, and so thus developing novel therapies or pharmacotherapies, for example, that will still improve the clinical effectiveness of existing reperfusion strategies for cardiovascular like condition presents sort of a therapeutic pharmacotherapeutic opportunities, intervention, and where interventions take many forms, but begin at the same time by acknowledging ischaemia in more depth. That draws this intro as part of this Ghromulin series to a close. This audio podcast, this intro and audio podcast as part of the Photon Saga, and this audio podcast as part of a Storm Robotics production.